Good morning, everyone, and welcome to Exploring Issues Encountered by Seniors During COVID-19. My name is Mary Ennis, and I am the Provincial Coordinator of the Newfoundland and Labrador Network for the Prevention of Elder Abuse, which is a very, very important part of SeniorsNL. The United Nations designated June 15th each year as World Elder Abuse Awareness Day. And that's a day in which people around the world use their collective voice to raise awareness about abuse of older persons. It is estimated that 16% of older adults over the age of 60 have been affected by some form of abuse. And that number has likely increased during the global pandemic of COVID-19 due to an increase of older adults seeking help during the pandemic. That was taken from an article out of McMaster University just last week. It goes on to say that knowing how to recognize potential signs of abuse is a critical first step in combating the issue. Unfortunately, we often fail to recognize early warning signs, and so the abuse can go unnoticed. The added complexities that the COVID-19 global pandemic has presented have made it even more challenging to identify signs of abuse and neglect. So I want you to keep that in mind today during our presentations from our three panelists, okay? It's really important that we learn to recognize the signs or the risk of abuse, the potential risk of abuse that people encounter, particularly under crisis situations. If you want to ask a question of any of the presenters, just type it into your computer and it will automatically come up on our screen here, and we will give it to the appropriate presenter to respond to. Also, we have a few questions of our own to ask you, the participants, and as we go through the day. And again, you can just type in your answers after you see the question, and it will be automatically, all responses will automatically be compiled, and after a minute or so, we'll let you see the result of those questions. We're very fortunate to have three panelists here today, and we have Lorraine Best. Lorraine is going to be our first speaker, and she is a peer support volunteer with SeniorsNL. And she's going to look at some of the emotional issues around COVID-19. Following Lorraine, we'll have Charlene Brophy, and Charlene is the Chief Executive Officer of 811 Line. And Charlene is going to take a look at some of the things that came up, some of the health issues that came up during the pandemic. And our final speaker will be Steve Ross, and Steve is a policy analyst with Adult Protection. And Steve is going to look at the financial aspects, and some of the risks of abuse that could be inherent there. Before we go to Lorraine, we're going to give you our first question right off the bat here. And the first question is, do you think elder abuse increased during COVID-19? Yes or no? Just type in your yes or no, and we'll wait about 60 seconds for everybody to respond, and then we'll close the poll. Okay, everyone, we're going to close the poll now. I hope all responses are in. Thank you. And we'll have the answer in a minute. Okay, everyone, 91% of the respondents online said yes. They do think that elder abuse increased during COVID-19. Thank you very much for the responses, and we will certainly be keeping them in mind as we move along here. Now we're going to have our first panelist, Lorraine Best, and I'll just hand it over to Lorraine.
Hello, everyone. As Mary said, I'm Lorraine Best.
That's okay, keep going.
Okay. Yeah. I'm Lorraine Best, and I'm a peer support volunteer with SeniorsNL, and answer the calls on the information and referral line. Okay. So when the office closed on March 19, the volunteers worked from home answering the calls, but I didn't do that as I did not have access to a computer. So I became a friendly caller. Anyone who called SeniorsNL and would like to receive a call, their names were passed to me, and I am still calling some of these people. This has been a difficult time for families, and especially for seniors, as so many seniors live alone and some do not have families. It still is for many, as we hear so often, we are not out of the woods yet. But now that restrictions are being relaxed, I'm finding as I go out more that people are not as careful as they used to be, although we are still encouraged to follow the guidelines of the health professionals. But we seniors must be most careful. And why? Well, we have been told over and over that seniors are the most vulnerable. What might happen to us if we contact the virus? It may be fatal, and that's scary. So we still have to be cautious. We still keep our distance. The fear is still there. And for a lot of seniors, this is not their way. We are friendly, and we like to chat with each other. We like to hug, and we can't. And we miss that. Seniors were concerned about their health. What will I do if I get sick? Will I be able to contact my doctor, get my medications? And if I have to go to the hospital, will I have to wait? And will I be alone? And will I be exposed to the virus? If I have to use public transportation, will it be available? And will it be safe? Another concern was having enough food. Some cut down on eating, afraid that they wouldn't. But I assured them that there were people who would deliver, and they could call SeniorsNL for help. And at night, when it seems to be a more anxious time, I reminded them of the numbers they could call to talk to somebody. Some were worried about their families, losing their jobs, looking after children, and they wouldn't call them for help. They didn't want to bother them. They felt they had enough to worry about and had enough on their plate. Some families may have had an older family member living with them, which could mean added stress. It could lead to abuse. Caregiving is not easy. A friend of mine called me last week and told me about one of her family members who was a senior caring for her disabled child, which she had done for so many years. And her child now could no longer go to the daycare program. So she has to care for that child full-time at home. And this is added stress for the mother. Then there were seniors in long-term care facilities who could not get a visit from family or friends, and many died alone. I know personally this has happened. And I have a close friend whose daughter was in hospital, and she couldn't visit her for that needed support. I know now of some seniors who live in a seniors building who have not come out of their apartments since the isolation started. They are afraid, and they miss the contact with the other residents, as they used to meet in the lounge for a chat. And for seniors living in their own home, if they needed repairs or if appliance gave out. A friend of mine told me that her stove gave out. She could only get a new one by ordering online. And some seniors don't have that option. They would deliver and leave it on her doorstep. And she was 6 weeks without a stove. These are some of the concerns I heard from seniors, and I'm sure there are many more. I appreciated being able to chat with these seniors. They have shared some of their concerns and some very personal. I trust I have helped in some small way. They have expressed to me how happy they have been for the call. And in helping them, I have been helped also. I have been blessed. These are trying times, and it has had an impact on our mental health. And although we are in alert number 3, we still have to be very careful. I believe one of the biggest stress for seniors was, and maybe still is, what's next? The fear of the unknown. Will I make it? But as seniors, we will. We have experienced many hard times, probably none like this, but we will get through. We are getting through. We will make it. We won't give up. So let's help each other wherever and whenever we can. And let us count our blessings. Thank you.
Thank you, Lorraine. I really appreciate that. Thanks for coming in today to do this.
Oh, you're kindly welcome.
We have a couple of more questions now following Lorraine's presentation. And actually, we have 2 here, a yes, no, and a true, false. Thinking back to when everyone was in their own bubble, do you feel it was harder emotionally for single people? Yes or no? The second question, I've just been asked to wait until the first one is responded to. Sorry about that. Okay, everyone, we're going to close that poll and move on to the next question. "99 respondents said yes to that question. They did feel it was harder emotionally for single people during the time when everyone was in their own bubble. The next question, following Lorraine's presentation, COVID-19 has impacted the way seniors view the value of social connections and relationships with family or friends. Is that true or false? Do you think that COVID-19 has impacted the way seniors view the value of social connections and relationships with family and friends?" Okay, we'll close the poll for that one and give you the results. "97% of respondents agreed that that is true, that COVID-19 has impacted the way seniors view the value of social connections and relationships with family and friends." That was 97%. 3% said false. And now we're going to move on to our next speaker, and that it will be Charlene Brophy from 811. And we're going to hand the screen over to Charlene now. Thank you, Charlene.
Okay, can you see my screen? Mary, can you see my screen? Hi, Mary. Hi, is anybody able to hear me?
Hi, yes, we can see your screen. Oh, great. Thank you.
Okay, great. Okay, I was afraid you weren't able to hear me. Well, good morning, everybody. Delighted to be here this morning and have an opportunity to talk a little bit about the company in 811 and what we do and so on. As Mary had said, my name is Charlene Brophy and I'm the CEO here at FullNet. And I'm just going to talk a little bit today about who we are, what we do, and the impact COVID-19 had on our operation and how we responded in particular to the senior population and so on. So for those of you unfamiliar with our company, we're an international virtual healthcare clinic. We've been based here in Newfoundland now. We started in Newfoundland and stayed in Newfoundland for the last 23 years. And we've got employees right throughout Newfoundland, throughout Canada, US, and the Caribbean as well. And we basically provide nurse advice services to patients right throughout North America and as I said, in other jurisdictions as well, over the phone. So we've got registered nurses licensed right throughout Newfoundland and Labrador, and we've got a similar operation throughout the US and Caribbean as well. So we've got nurses who take phone calls from patients and provide healthcare services and advice virtually. In Newfoundland, we're known best because we run the 811 service. So for anybody who's in need of health advice or nurse services, they can dial 811 from any landline or any smartphone and have access 24/7 to a registered nurse who's located right here in Newfoundland and Labrador. So the types of services that are available under that umbrella of 811. In addition, as I said, in addition to the 24/7 registered nurses, we provide very basic triage and health information services. So by triage, I mean anybody who's got a symptom, whether it's a physical symptom of a headache or abdominal pain or whatever the case may be, they can call, and we've got clinical algorithms that we use to assess patient symptoms. It's almost the exact same as if you were to walk into the emergency room, except the difference is instead of us triaging with our eyes when you walk in, we're triaging with our ears. So we would ask a series of questions to determine how serious the situation is and what you need to do to manage that at home. That could be as simple as telling you to take a couple of Tylenol or whatever the case may be, or it could be as complex as arranging for an ambulance to come if it's a true emergency situation and so on. In many cases, we can provide care advice at home on how to treat a specific situation, and it may be, something as simplistic as an ingrown toenail, which is extremely painful for a senior, as you can well imagine. Then we can walk somebody through how to treat that at home and how to ease the pain and so on. And that's particularly important for diabetic patients, or those with multiple comorbidities who are really at risk and so on. We also provide and have access to the provincial community resource database. So we receive a fair number of calls from individuals with questions about how to access a certain service in their geographical area, and we have full access to that database. So we can help provide phone numbers or addresses or make connections with resources in seniors communities who previously were unaware of where to reach out for help. We also provide mental health type of services. We deal with a fair number of calls from individuals who are calling with health concerns, and our registered nurses have also received advanced training in managing those type of calls as well. We've got a dietitian on staff, which many are still unaware of, I believe, in the province today. So this dietitian can help answer any questions that seniors may have related to their diet if they're a diabetic patient, what they can and cannot eat, concerns about their blood sugar levels and the impact that their diet is having on that and so on. Or if the doctor has prescribed a low-fat diet and a low-salt diet or a low-sodium diet, what does that mean? We've got a dietitian that can speak with you over the phone, can provide information, and can even send out information either through email or through, just a letter that we can send out through Canada Post with some information that can help seniors better manage their diet at home and so on. And as of last week, you probably heard some of the buzz around the new offering that we announced just last week with Minister Haggie, which is access to a nurse practitioner virtual care clinic. And we just recently added the nurse practitioners onto our line to provide an additional resource for seniors and for the people right throughout Newfoundland and Labrador. And it is no way a replacement for a primary care physician whatsoever. It's simply another access point. It's a support of the current medical care system that's in place rather than trying to replace it in any way, shape, or form. But particularly beneficial for seniors who are maybe experiencing some medical issues that make it difficult or unable to get out to see their doctor or to access their doctor and so on. It's great. It's a great resource to be able to have for nurse practitioners to be able to diagnose and treat and if necessary prescribe and so on. So that's a new service that we just introduced. You may have heard last week. During the COVID-19 outbreak, we had quite a few calls from seniors who were concerned about food security and how do they access food and have no way of getting out and getting groceries and so on. So we partnered with the provincial government, Food First Newfoundland, and Jimmy Pratt Foundation to assist with the establishment of support for seniors related to food security. Basically, 811 became the point of contact. So anybody that had any concerns, with accessing food or so on, we were equipped with the resources to be able to navigate some of those calls and be able to make connections with seniors with various resources within their community and so on. And that very quickly was raised as a need very early on as this outbreak started to unfold. And we were able to work with the province and offer that service as well. When we look at the impact, we're going to talk a little bit about the impact to see. When I look at the impact to the provincial helpline alone, almost overnight, we couldn't have even imagined about the volume increase that was about to take place. So we had, within 48 hours, a 700% increase in call volume to 811 as compared with this same day of the previous year. So you can only imagine the scramble to try to respond to that. We had prepared already. We've done, we've worked through pandemic situations and so on in the preparedness programs and so on in the past. So we were as well prepared as we possibly could be, but nobody imagined how this would just unfold overnight. So we've got as I said, we've got a very skilled team here in Newfoundland and Labrador, and everybody just rolled up their sleeves and, and helped respond to the outbreak as it was unfolding. So we brought on an extra 100 registered nurses and intake staff just to meet the demand. These are people that we hired all throughout Newfoundland and Labrador that came on. We trained them on our software system. We trained them how to use our telephone system. And they came on and helped us to triage the various calls that were coming in from people who were frightened, as you can well imagine, on what is this impact? Am I safe? I've got a sore throat or a headache or whatever the case may be. Is this a sign of COVID? People were scared, and rightfully so. So we needed to make sure that we responded as quickly and swiftly and efficiently and effectively as we could. So very busy time, as you can imagine. And then we also worked extremely closely with the Provincial Ministry of Health in providing daily surveillance reports. So that's basically breakouts of symptoms in certain geographic areas of the province to help us track if there was a particular area that is more concerning than another, and so on. So that was ongoing daily, and initially it was 4 times every day we were providing those reports, just so that the province could be aware and would be informed of where outbreaks were happening and so on, or potential outbreaks. And then if I were to look at the positive impact of COVID, I think it's awareness of 811. Because prior to COVID-19, there was very little awareness, especially with the senior population, of the availability of 811 and the resources that it could provide to seniors in our province and so on. So if there's one, a bright light at the end of all of this, you always look for that, and it's the awareness of 811 service that I think was previously not out there for sure. When we looked at call types and the types of calls that came in from the 65 plus population, most of the types of calls that we received were, as you see on screen there now, these are the most common. Calls from individuals with high blood pressure, wondering what to do. Or in many cases as well, low blood pressure. Do I keep taking my medication? What should I do to treat it? And so on. We had many calls from patients experiencing chest pain and difficulty breathing, that, which they're trying to discern if the difficulty breathing was because they were so upset and worried that they were going to get sick, or if there was actually some sort of a respiratory illness ongoing that we needed to address and so on. We have many calls, and probably one of the most popular ongoing calls is from seniors with urinary symptoms. So who have a history of recurrent urinary tract infections and symptoms are back again, and how do they get treatment and so on. And again, that's an example of a real positive for having nurse practitioners on who can help diagnose and treat urinary tract symptoms over the phone. A lot of calls with back pain and headaches and abdominal pain, which is typically much the same type of situations as you would see in an emergency room, or sore throat and so on. And then a lot of questions related to heart rate and heartbeat, that they think their heart was beating fast. Again, is this just because they're panicked because of the anxiety, or is there a concern, cardiac concern that we need to address and so on. So we would assess that over the phone through a series of questioning, and then determine what the outcome, of the call should be, whether they needed to access care or whether we could monitor them at home and so on. And you will see on the screen, one of the frequent calls we have is related to poisoning. And for the most part, when I say poisoning, it's not necessarily taking in a substance that's toxic to an individual. Many of these type of calls are, oh my gosh, I just realized I took a double dose of my blood pressure medication or my diuretic, or whatever the case may be. I totally forgot I had taken it and I just took it again. Am I going to be okay, or what's going to happen to me? So we could help them manage that, help them, to be aware of if it was a true situation that required medical attention, or if not, how to monitor themselves at home and when to call back. And we could do a follow-up call to those individuals as well. And then last but not least was a lot of calls related to mental health, a lot of anxiety type of calls. People were very concerned about their own safety, were concerned about their children and grandchildren and so on. It was such a difficult time for so many people. And I think just having a voice on the other end of the line that could kind of help them provide some sort of reassurance that you're not in this alone and there is somebody there. And if you do get sick, you can call us and we'll help you access resources and so on. So that was the most common type of calls that we received during the pandemic situation. And then the big concern was as everybody heard the reports on the TV, was about the dire outcomes. What does this mean for seniors? What is this going to mean for me? And so on. And, everybody was watching the reports that, show that the older adults are most likely to have the most dire outcomes from this virus. And, nearly half of the deaths in Canada at the point were related to outbreaks in long-term care homes and so on. And the bulk of the deaths in Canada have been really in the senior population, and the seniors were concerned. What does this mean for me? Am I safe here in my own home? Should I even have my caregivers come in? Is it safe? Am I more at risk if they come in and so on? So it was really trying to find a balance that, the risk versus benefit, and trying to help them to determine how much they could do on their own, who actually absolutely must have their caregivers in, and how to protect themselves and their caregivers while they were in their own homes and so on. So we had a fair number of questions related to that as well. And then a lot of concerns about prevention. How do I stop this from happening? How do I make sure that I'm safe as I can be and so on? And there was a big concern about, can my daughter come in? I'm, living in senior building or apartment building, or I live on my own in my own home. Can my family come in and so on? And, for the children as well, there was, or the caregivers, there was quite a bit of stress as well in trying to determine what is the right thing to do. I mean, many caregivers, especially family members, are exposed to so many other individuals, and everybody they were exposed to is preventing, a risk to their parent and loved one and so on. So there was a lot of anxiety related to that, and the social isolation that accompanied this COVID-19 outbreak was great. We found that it was greatest to those who did not have access to technology. And the reality is many seniors in our province today simply do not have access. They don't have access to FaceTime or Zoom or any way whatsoever of being able to communicate with individuals during the time like this. So the effects were certainly compounded for any older person who didn't have access to Skype or FaceTime and so on. And even many seniors whose family live out of province, have phone plans that have limited access. So many older people were forced to have to choose between pay-per-minute phone plans or, have a virtual visit with their doctor or with their grandchild or whatever the case may be. And that absolutely remains an issue today. We can't assume that switch to a virtual socialization or virtual access to resources is going to work for the older population of our province as well. I talked a little bit about the food security, and once we had that line and awareness up and running, we had quite a bit of uptake on that, and I think that did provide reassurance for the senior population of the province that there was access, and in each and every community we had resources that were available to meet the need and so on. And then, again, to the caregiver stress and the mental health deterioration, there was so much concern from family members whose husbands or wives were in hospital and they weren't able to communicate with them and so on. Concern that their mental health status would not be as good as it possibly could have been had they been able to have access and so on. And, for individuals who are in hospital, there's always some concern with confusion, and having access to people who they know and love and so on certainly helps lessen that situation. So there was quite a bit of concern around the impact on mental health, especially for individuals who were in the hospital and did not have access to their caregivers or loved ones during that time. So I guess in closing, I would say, how to help. What have some of the lessons been learned for us, and what we can do? I would say first and foremost is to reach out, to seniors who are alone, to those in your community. It could be neighbors, to those who are in need, just to have a phone call or, just to reach out to see if there is anything that they need and just offer, a voice. Just everybody needs to know that somebody cares. And I think every one of us can be that voice to somebody in our lives. I think we need to advocate, each and every one of us need to advocate for our seniors population against the theory of ageism. That, individual may be 80 or 85 years old and so on, and what do you expect? I think we all need to advocate so everybody is aware, and we never let them forget that the last 20 years of anyone's life is just as important as the first 20 years. We got to advocate on behalf of our seniors, and that's a responsibility that each and every one of us should have. And then start to have sometimes tough conversations, especially when it comes around, with our loved ones around directives, healthcare directives. And heaven forbid, should you become ill, but if you do become ill, how do you want me to respond? How do you want, the last years of your life to look and so on? And I think that's a tough conversation for many of us to have. But to talk to your parents around that, to put it in writing as need be and so on, I think that's of paramount importance, because for family members, once individuals do become ill, to try to make that decision, it's a very, very difficult decision for any of us to have to make when it comes to our loved ones. So it's a tough conversation, but I think it's a conversation that, we need to keep in the back of mind and front of mind that we need to have with our loved ones to say, this, how do you want to respond? You tell me, because each of us has the right to determine, what path our life takes going forward and so on. And then last but not least, let's keep the conversation going about resource awareness, just to make sure that every senior knows there's resources available to them to be able to manage any concern, any issue that they're worried about and so on, whether it's mental health related or physical symptoms, whether it's access to food security or concerns with their anxiety or depression and so on. There are resources there, and if you're unsure where to go with it, call us. We call 811. You can download the app, but you can just pick up the phone, dial 811 24/7, and you'll have access to a registered nurse. So thanks, everybody. I hope that helps a little bit with the awareness of services available in the province.
Thanks so much, Charlene. That was a lot of really good information, and you worked hard during COVID, and I'm sure everybody over there is still working hard.
Yeah, we sure did.
I have 3 questions now following Charlene's presentation, and get
Say something. Say something. You're not. You should be okay.
Did everyone get that question? Have you used any of the following services during COVID? Is someone not muted up there? Are all responses in? Have you used any of the following services during COVID-19? Virtual care, Channel Warm Line, Bridge the Gap, Doorways, or the Mental Health Crisis Line? Okay, that poll is closed and we're getting the results are coming in now. Thank you. 58 respondents reported using virtual care, a doctor or the 811 line, and 5 used Bridge the Gap, and 2 the mental health crisis line. So thanks very much for that. And that's all the questions we have following Charlene's presentation. And so now we're going to move into our final speaker, and that is Steve Ross. And Steve is the Adult Protection Consultant in the Department of Children, Seniors, and Social Development. Steve, are you ready to take over?
Yeah.
Good morning, everyone. Can everyone hear me?
Go ahead, Steve.
Perfect, thanks. So good morning, everyone. My name is Steve Ross. As Mary pointed out, I'm a social worker and adult protection consultant with the Department of Children, Seniors, and Social Development. I'd like to thank everyone from SeniorsNL and the network for having me today. I'm very pleased to be part of the webinar and look forward to the discussion. Today, I will be discussing financial elder abuse and how that's been impacted by COVID-19. I'm sure many of the themes I will touch on are going to echo what other folks have said today. Just as a general overview, I thought it might be helpful just to provide an overview of the concept of financial abuse, some just definitions, examples, and some signs that it may be occurring, and its general prevalence. A discussion of how that's been impacted by COVID-19, and then I guess just a brief discussion how we could potentially respond. So in terms of defining financial abuse, folks, as you can appreciate, there are a lot of definitions out there. One definition that I particularly like comes from the National Initiative for the Care of the Elderly, which defines financial abuse as an action or lack of action with respect to material possessions, funds, assets, property, or legal documents that is unauthorized or coerced or a misuse of legal authority. So in the context of financial elder abuse, folks, it really speaks to the illegal and or improper use of an older person's property, resources, and assets. But I think another important point to make on this is that financial abuse can, of course, be overt theft and fraud, but it can also be much more subtle. I think in some cases it can be difficult to name and can really come from a sense of undue influence or from a person's vulnerability in a particular relationship or in society as a whole. And I think this is particularly important in the context of COVID-19 and given the impact that that's had on vulnerable populations. And folks, you can really see this in a lot of the examples of financial abuse. So just a brief of some of the examples. I know, for example, theft or fraud of assets, property, and or finances, the improper use of powers of attorney or guardianship duties, pressuring an adult to sign a legal document without full understanding, and of course, frauds and scams. But you can also see situations where it'll be less overt. So, for example, exchanging care for financial control, providing food and shelter without someone paying their share of expenses, or even making unwanted or unnecessary purchases. So again, that's not an exhaustive list, but I think really points to the scope of the issue. And I guess in respect to some of the signs, because it also raises the question of what are some of the signs of financial abuse. And of course, this can include, irregular activity in bank accounts, declines in standard of living, unpaid bills, or the emergence of new friends or caregivers, or new and irregular legal documentation, for example. And of course, changes in mood and personality, and or even a refusal to spend money without permission of others. So I think, though, and we kind of alluded to this in previous conversations, that of course these signs can be difficult to detect even in normal times. But I think it's important to note that in COVID-19, I think some of these warning signs might be less glaring, particularly due to social isolation. And I think these are all things that obviously we need to be attentive to at all times, but I think in the context of COVID-19, certainly more attuned to. And folks, just in terms of some general prevalence, I know the National Institute for the Care of the Elderly did a study in 2015 that estimated financial abuse of older persons to be around 2.6%, so it's over 200,000 people. I know from our side in adult protection, in the first 5 years of the Act, we've had over 1,500 reports in total, and 80% of those reports concern folks over the age of 60. And approximately 14% of those reports concern financial abuse. So it was the fourth highest type of report type that we saw behind neglect, self-neglect, and physical abuse. But folks, I guess I think it's generally understood to be that financial abuse is generally underreported. And I know even the government of Canada alludes that financial abuse is the most common form of elder abuse. And I think financial abuse is likely to be reported, well, for a number of reasons, but I think for two particular reasons. I think on the one hand, it can obviously be sometimes very subtle and difficult to see. But I think another thing at play in this, I think, will be this notion of, there could be a fear of reprisal, particularly in cases where there's a dependence on the financial abuser for care. So I think that often means that many seniors feel they cannot report the abuse, but I think we really need to continue to support them to do just that. So in terms of what all this means, I guess, in the context of COVID-19, I really feel like the impact of COVID-19, well, it's likely twofold. I think, and we really touched on this in previous conversations, but I think number one, I really think the pandemic's exacerbating existing risks in relation to financial abuse. So we're undoubtedly seeing a rise, for example, in frauds and scams. I know, for example, the Canadian Anti-Fraud Centre's taken over 1,000 reports of COVID-19 fraud. But other instances, folks, you can imagine, people are losing their incomes, may become more reliant on parents and grandparents, and, or families moving back home. I think all of this is going to put more pressure on older persons. Or even in terms of, the one-time OAS and GIS payment that's coming out in July, you could see some challenges that come financially with that. And of course, all the conversations that have occurred around the CERB. You could imagine situations where there might be pressure from family or caregivers. And of course, with the CRB, also general frauds and scams. I mean, there've been reports of people getting phone calls of, offering help with filling out the application and such like that. And of course, folks, again, I know touched on quite well in previous conversations, but I know a lot of the risk factors for elder abuse, such as mental health challenges and low social supports or family conflict, have certainly increased during the pandemic. So I think all this really points to that. I think that risks that may have existed before are really being amplified by the crisis, and it's likely increasing the risk of financial exploitation for folks. And I think another impact in general to folks that we see is that I think COVID-19 is really increasing vulnerability to financial abuse through just, again, as we touched on in previous conversations, through that heightened sense of anxiety and social isolation. A person's maybe more, for example, susceptible to frauds and scams due to social isolation. And we also know, of course, that social isolation is a big barrier to getting support. So obviously it really speaks to the importance of keeping folks connected. And of course, all this is occurring against the backdrop of the larger financial insecurities that are being felt by seniors in general. I think, of course, another aspect, financial challenges have been, folks who only use cash, or, folks, as we touched on earlier, do not know how to order supplies online, or do not have the technology or tech support required to order online. And of course, other issues that have come up are, I know, around dispensing fees and rising transportation costs, rising food costs. So again, I think there's a broader context going on as well. And of course, another big point I feel to consider in the context, folks, is that although the conversation is slowly and gradually shifting to more of what a post-COVID and what that looks like, I think it's also potentially fair to say that many of these financial risks and economic insecurities are likely going to remain amplified into the near future. And I think that's something to consider as we're moving forward, particularly as it relates to the risks of around financial abuse. So I guess another big point too, folks, and I can kind of wrap it up with this piece, is I guess, how can we respond moving forward knowing all these about these risks? So I think there are a number of areas, but I would love to get other people's thoughts on this as well. Of course, criminal law and police involvement is very important, particularly in case, of theft and forgery and fraud. But of course, civil law is very important as well, folks, particularly, for example, the Adult Protection Act. So this is an act that's designed to protect adults who are at risk of abuse and neglect, but of course, who don't understand and appreciate their risk. And we all have a duty to report under that law, and that law does in fact cover financial abuse. But I also think too, folks, I think awareness raising is key. And I think platforms like the network and SeniorsNL, of course, are instrumental in this piece. And another big one, it was kind of alluded to in a previous conversation, continuing the conversation around advanced planning, particularly around powers of attorney as a means to prevent financial abuse. I know there were some conversations around with issues in these areas as well, but I think advanced planning could be helpful for folks that, particularly for folks that lack capacity. So there are responses available. So I guess, folks, just as a conclusion, I guess as a whole, I think a couple of takeaways for me, I guess, I think the signs of financial abuse are not always really easily recognizable. And I think this has been particularly accentuated by COVID-19, particularly through social isolation. And I think the crisis has really amplified existing risks and certainly increased vulnerability to financial abuse among seniors. And I guess there's also the potential these challenges could remain amplified as we move forward into a more post-COVID type world. And again, I think that all really speaks to the importance of keeping seniors connected and raising community awareness and really making the necessary reports under the correct laws. All key ways, I think, to address the problem. But that's it for me, though, folks. But I'd like to throw it open, obviously, to other folks to get their thoughts on the subject and get a sense of what folks are hearing. Thanks so much.
Steve, thanks very, very much. That was very informative. I really appreciate it. It's interesting. You think of so many scenarios where people are put at risk of abuse, especially during a pandemic. I was just thinking, people at home, seniors living alone, for example, they are in such a vulnerable position And if they're afraid during the pandemic, they're not leaving their houses and they're not seeing anyone. And they don't have the means to communicate except by phone. And then some people are very isolated and probably don't have anyone on the phone anyway. One of the things that SeniorsNL did during the pandemic, we had a sum of money from United Way, and we offered grants of $1,000 to 95 different groups across the island of Labrador. And so many people would phone and, to report in after they probably dropped off food hampers or some kind of a gift package. And they would say, Mary, so many seniors, they cried when we went to the door. They were so grateful to see someone and so grateful that someone showed that they were being thought about. There's so much loneliness attached to that. And then, of course, we have seniors living in homes with their adult children, and stress could be increased. Look at all the layoffs and all the job losses that accompanied COVID. So people are in dire straits. They don't know how they can't live the same lifestyle that they were living before COVID. And the close proximity is, and being in a bubble with one or two other people. It's a real spawning ground for abuse. Yeah, it's very difficult. Anyway, I do have a couple of questions after Steve's presentation, and we'll do another poll. Have you or anyone you know been a victim of a recent COVID-19 scam? There were a lot of scams on the go out there. I think over 400 in Canada alone. So have you or anyone you know been a victim of a recent COVID-19 related scam? Yes or no? Okay, poll is closed and we are getting our results. Some good results this time. 94% say no, and only 6% yes. So that's excellent. I think, there's a lot of awareness being raised about scams out there over the last few years, and it seems like a lot of people are, taking that to heart. So that's excellent. The last question I have: in order to access food or other products, did you give anyone your credit card or bank machine card to use on your behalf? Yes or no? Because a lot of people, particularly seniors who, did not want to venture outside. They certainly didn't want to go to grocery stores or to go to other business places if they might need something. And so they may have given their credit card or bank machine card to someone else to use on their behalf. So in order to access food or other products, did you give anyone your credit card or bank machine card to use? Yes or no? The poll is closed and we're coming up with our answers. 18% say yes, they did give their card to someone, and 82% no, they did not. It's difficult sometimes, to know who to really trust with that kind of information belong to, cards and everything. And it's a good rule of thumb not to give it. But if you do give someone your card to act on your behalf, make sure you know who it is and you have complete faith and trust in them. I don't know if we have any questions no questions have come in for the presenters. Does anyone have any questions, or would anyone like to make a few comments? Just type in and, yeah, just type it in and we'll take it from there. Sorry. Well now, Steve, we have a question here for you. Can you give a brief review of the Adult Protection Act?
Sure, yes. So folks, can everyone hear me?
Yeah. Yeah.
Okay, perfect. Yeah, so folks, so the Act is still relatively new. It replaced it's been in place since 2014, so a little over, well, almost 6 years old. And so folks, the Act is the law in Newfoundland and Labrador that protects adult residents who do not understand or appreciate the risk of abuse or neglect, and that includes self-neglect as well. So obviously, under the Act, an adult in need of protective intervention means an adult who lacks capacity and is either incapable of caring for themselves, or who refuses, delays, or is unable to make provision for adequate care or attention for themselves. I guess a couple of points on that, folks. So I says, under the Act, if a person believes an adult that might be at risk of abuse and neglect and has a reason to believe they lack capacity, there is a legal obligation to report that information. There is a dedicated 24-hour toll-free telephone line to make that report. And I guess just in terms of process, you know, if a report is determined to meet the criteria of abuse, neglect, or self-neglect, and it's not clear the adult has capacity, then the report is accepted by a social worker and is evaluated to determine whether to make further determinations. So basically, during an evaluation piece, the social worker is going to assess the situation and, you know, speak with the report source and interview or observe the adult. And I guess there are really mainly three outcomes from that piece. So really, there would be no further intervention, you know, or in this case, I guess really the big piece or the goal would be to offer that professional supportive services to reduce the risk. But of course, there's also opportunities where it could proceed to a much larger investigation. I guess big takeaways from it, folks, would be, you know, I think capacity is central to the Act. So folks it is required that folks lack capacity to come under the legislation. And to lack capacity, we're really talking about one's ability to understand and appreciate risk. Another big point I guess we make as well is that the Act is considered an act of last resort. That is, so all other options are really exhausting before we really go the full length of the legislation. And I think the ultimate goal under the Act is really to attempt to mitigate risk in the least intrusive manner. And I guess that will be, I guess, the main takeaways from me. And I should note as well, folks, that the Act does apply regardless of your to all adults, regardless of their living arrangement in the province. So that would include, it could be obviously in your own home, in the community, or it can also include a facility. So that's about it for me, folks. I hope that was helpful.
Thanks, Steve. Could you repeat the number for the Adult Protection Act, the phone number if anyone wants to phone?
Yeah, just 1 second there, folks.
Steve, I do have another question here for you as well. What is the difference between neglect and abuse?
Sure, yeah. So the number, folks, will be 1-855 376-4957. And what was the question again, sorry, Mary?
The question, Steve, is what is the difference between neglect and abuse?
So just in terms of, I guess, self-neglect, folks, is really the term that we use in the Act to describe whether the adult is incapable of caring for themselves. So I guess that's really is of concern when that failure causes or could cause serious physical or psychological harm. So in that case, this means that in the judgment of a professional, an incident is likely to occur. So it really the Act defines self-neglect as a substantial damage to or substantial loss of assets, for example, could be one from a financial perspective. And I guess in that case, just to give a couple examples, so an adult could be living in grossly unsanitary conditions, could be suffering from malnutrition or untreated illness, or of course an adult could create a hazardous situation such as a fire risk. Those would all be, of course, examples. In just 1 minute, folks, I'll give you the exact definition of how we define abuse under the Act. And then under the Act, we define abuse as the deliberate mistreatment of an adult who lacks capacity to protect himself or herself. And it causes or is reasonably likely to cause within a short period of time serious physical, psychological, or emotional harm, or as I alluded to, substantial damage or substantial loss of assets. And I should note too, folks, that the Act does cover, from a policy perspective, 9 different types of abuse. So we are talking about physical and financial, but it also could include emotional, spiritual, and of course self-neglect and neglect, as I mentioned. I hope that's helpful, folks.
Yeah, thanks, Steve. We do talk about neglect as abuse. Neglect is abuse, but there's 2 types of neglect. We refer to them as active neglect and passive neglect. Active neglect would be the deliberate withholding of food or medication, or refusing to take care of someone's hygiene, that kind of thing. And passive neglect is similar neglect, but not realizing that you're doing it. Like, you don't know how to take care of a person properly. That type of thing. But yes, we do regard neglect as abuse. And I do, Steve, have another question for you, and then maybe I'm going to put Lorraine on the hot spot. The RNC has a unit for domestic abuse. Is there anything like that for seniors? I don't think so, but what do you say, Steve?
Can you repeat that once more, Mary?
The RNC, the Royal Newfoundland Constabulary, has a unit for domestic abuse. Is there anything like that for seniors? I will say that the RCMP and the RNC are both well aware of abuse against seniors, and both parties have representation on the steering committee for the Newfoundland and Labrador Network for the Prevention of Elder Abuse. I have not heard of a specific unit in terms of abuse against seniors.
No, so and I can say under just adult protection now, I know. So for example, all the work operationalized in the regional health authorities. So if a report is made and it's accepted, then basically the assessment of risk and the assessment of the situation in general would all go through the regional health authorities. And at that point, and then a further determination will be made from there. But no specific unit, but there are, of course, dedicated staff who are responding to reports and risks under the Adult Protection Act.
Okay, thanks. Thanks, Steve. Lorraine, I have a few questions for you now. The first one, are there instances where seniors are not aware of the abuse against them? And what do you do in cases like that? If someone calls and, you feel they are being abused? What is it?
Seniors are not aware of the abuse against them. Yeah, there are people, there are seniors who are not aware because some people still do not know what abuse is. And so it's so important to talk about it and to educate them. And some that know that they think that it's abuse, or they might know it's abuse, but they're reluctant to do anything about it because most of the abuse is done by adult children. And who's going to tell on their children? So they are reluctant to do that, and they certainly wouldn't press charges. And they don't want other people to know that their children are abusing them. So you have it. We really need to talk about it. It has to be in the forefront. And how often do we hear about it talked about in the public? You know, we don't. And if we don't, it's just going to be pushed under the rug, and there's going to be more abuse happening. I don't know that answers your question. Oh my, give example of abuse. You want me to be here all day? Oh, let me see if I can wreck my brain. Yeah. Well, you know, I recall some examples of a senior being abused by their grandchild, and wouldn't say anything about it because they're told, don't you speak about this. I mean, they're afraid to tell because they're afraid of more abuse. And when a granddaughter went over to visit one day to her grandfather, he spilled some liquid on his shirt, and she wanted him to take off his shirt so that she could put a clean one on. And he didn't want to do that. So when she finally got him to do it, she found that he had bruises on him. And then it came out that his grandson, who he was living with and supposedly being taken care of, was being abused. And it says, what did we do? Well, what we have to do now, we can talk to them, you know, we can talk to the person who calls, but we do have to refer every call that we get to the adult protection people, where Steve is, or Steve works. So, and I don't know if that answers your. But we do like, and when you said about, if somebody asked a question about the RNC, about a question about the RNC will report it to the, as far as I know, have to report it to the adult protection people. Is that right, Stephen? Is Stephen still on?
Yes, that's correct, folks. So any report would ultimately go through the regional health authority. That's right. Yeah.
Yes, that's right. Oh, that's the name of the regional health authority. I hadn't got that right.
Thank you, Lorraine. We did have another question here from one of the recipients of the United Way funding grants that I referenced a few minutes ago. And she and her group are very interested in continuing to give support to some of the seniors in their community who are, you know, living alone or not, probably ill, isolated. And she wanted to know about how to go about doing a survey to identify the seniors and find out what their needs are. And I know who you are. Anyway, I will give you a call about that, and we can chat about it, because I mean, there are ways, you know, to issue surveys in communities and identify seniors and find out what their needs are. Okay, the next question, Steve, are you still with me? Steve?
Yes, yeah, sorry.
Is someone liable if they suspect abuse and don't report it?
Yes, so folks, we do have a duty to report under the legislation. And obviously, I think it's still a relatively new piece of legislation, so I think people are still growing in their awareness of it and their duty to report. But yes, you are required under the Act to report it, and you can report confidentiality, I would add as well.
Yeah, it's interesting too, now that we've got that topic on the table here. There are so many seniors, unfortunately, there are a lot of seniors out there who are not reporting abuse because particularly if the abuse was perpetrated by a family member. They don't want their families to see their families get in trouble. They don't want their families to probably have to go to jail, etc. And it's so understandable. You could really understand that. But, in a way, what's happening there is by allowing the family member to take advantage of the senior is enabling that person to continue to take advantage of the senior themselves or of other people. So it's really a difficult call to make there. Yeah, but yes, people do have to report abuse or they are liable if they suspect abuse and don't report it. I think we have another question coming up. Oh, question for Lorraine. Did you feel disconnected because you didn't have a computer when you were at home?
Oh dear. No, I never feel disconnected if I don't have a computer. I'm not technically minded, although I use one here at SeniorsNL. I have to. I had a computer and I gave it away a couple of months ago. So I don't feel I don't feel disconnected because there are other ways that we can get through. But one of these days, I'm going to get, what do they call them? Not a laptop, an iPhone, an iPad. I'm going to get an iPad one of these days, and I'm going to get Mary to show me how to use it.
No, I can vouch for that. Lorraine doesn't feel disconnected. I mean, when we're open, working at full steam here, Lorraine is in, 2-3 days a week on the phone, 4 days a week on the phones, answering calls or helping staff with other things. So I don't think we have any more questions. I want to thank everyone very, very much for being with us today. It was absolutely fabulous. And of course, you're always welcome to get back to us, get in touch with us, send any comments if you like. And I do want to give you our contact information now so that you'll have it. So if you grab a pen and write it down, that would be fabulous if anybody wants to get in touch. We have a toll-free 1-800 number for the island, and that for Newfoundland and Labrador, sorry, 1-800-563-5599. 1-800-563-5599. Or by email to info@seniorsnl.ca. All small letters, info@seniorsnl, SENIORSNL, all one word, .ca. So please get in touch. We'd love to hear from you. And everybody stay safe, take good care, and keep following those regulations that are in place, okay? Goodbye, everyone. Thank you.